What if I told you that right now your body is sending you secret messages about one of your most vital organs? Messages written in your urine, displayed on your fingernails, and even hidden in your breath. Today, we're decoding these mysterious signals that could literally save your life. Welcome back to WellDocs, where we transform complex health science into actionable knowledge you can use today. I'm here to share something that shocked me when I first learned it. Nearly 9 out of 10 Americans walking around with serious kidney damage have absolutely no idea their health is at risk. These aren't just statistics. These are your neighbors, your family members, maybe even you. But here's the incredible part. When we catch these warning signs early, we can often reverse the damage completely. If you're serious about protecting your health and want more content like this, hit that subscribe button and ring the notification bell. Trust me, this information could save your kidneys. And I've got so much more health wisdom to share with you. Picture 2 remarkable organs, each about the size of your fist, working tirelessly behind your rib cage 24/7. Your kidneys aren't just simple filters. They're sophisticated chemical laboratories performing over a dozen critical functions every single day. Sure, they clean toxins from your bloodstream, but that's just the beginning. They're constantly balancing your body's chemistry, managing your blood pressure, creating hormones that build your red blood cells, and even maintaining your bone strength. When these powerhouse organs start struggling, your entire body feels the impact. So how do you know when these vital organs need help? Your body has developed an intricate warning system, and today I'm going to teach you exactly how to read these signals. Warning sign number 1, the foam test. Let's start with something you can check right now. And I mean, literally pause this video and go test this if you want. Next time you use the bathroom, take a quick look at your urine. I'm not talking about a few bubbles that pop immediately. I mean thick, persistent foam that looks almost like the head on a freshly poured beer. This foam is actually your body's alarm bell, screaming for attention. Here's what's happening inside your kidneys at the microscopic level that will absolutely blow your mind. Each kidney contains roughly 1 million tiny filtering units called nephrons. Within each nephron sits an incredibly delicate structure called a glomerulus. Imagine it as the world's most sophisticated coffee filter, but 1,000,000 times smaller. This filter is lined with specialized guardian cells that have tiny finger-like projections, reaching into your bloodstream like microscopic tentacles. These projections create a living barrier that's so precise, it lets waste pass through while keeping essential proteins locked safely in your blood. But here's where things get terrifying. High blood sugar, elevated blood pressure, and certain toxins can damage these guardian cells. When they're injured, they lose their grip, creating gaps in your body's protective filter. Suddenly, vital proteins like albumin start leaking out like water through a broken dam. The reason you see foam is actually fascinating. Albumin has a soap-like structure that creates this telltale, frothy appearance. It's literally your body's way of making an invisible problem visible, like nature's own warning system. Warning sign number 2, the thumb test. Okay, here's where we get interactive. I want you to try this with me right now. This is a simple test that medical professionals use in hospitals worldwide, and you can do it in your own living room. Roll up your pant leg and press your thumb firmly into your shin bone, right below your knee. Hold it there for 5 full seconds. 1 Mississippi, 2 Mississippi, 3 Mississippi, 4 Mississippi, 5 Mississippi. Then remove your thumb and look closely. If you see a clear indentation that doesn't bounce back immediately, like your leg just became Play-Doh, you're looking at something called pitting edema. This isn't just simple swelling. It's a sign that your body's fluid balance system is completely breaking down. Remember that protein we just talked about leaking into your urine? Well, albumin doesn't just create foam, it plays a crucial role in keeping fluid where it belongs, inside your blood vessels. Think of albumin as tiny molecular magnets that hold water in your bloodstream through a process called osmosis. When you lose too much albumin, fluid starts escaping into your tissues like water leaking from a broken pipe, particularly in your legs and feet where gravity pulls it downward. You might also notice puffiness around your eyes, especially when you wake up in the morning, making you look like you went 10 rounds with a heavyweight boxer. Here's the vicious cycle that develops, and this is where it gets really scary. Even though you're visibly swollen, there's actually less fluid circulating in your blood vessels. Your kidneys detect this and think you're dehydrated, so they panic and start hoarding salt and water, making the swelling even worse. It's like your body is fighting against itself. Warning sign number 3, the night shift problem. Here's something that's going to completely flip your thinking upside down. Most people think that urinating frequently means your kidneys are working overtime and must be healthy. This is actually backwards thinking, and it's a dangerous misconception. When it comes to kidney function, quality trumps quantity every single time. Think of it like this. Would you rather have a water filter that processes a lot of dirty water, or one that efficiently purifies exactly what you need? One of the first abilities your kidneys lose when they're in trouble is the power to concentrate urine effectively. It's like they forget how to work efficiently. This becomes most obvious at night when your body should naturally be producing less, more concentrated urine. Normally, a hormone called antidiuretic hormone, or ADH, signals your kidneys to conserve water while you sleep. Kind of like putting your body into water-saving mode. But when your kidneys are damaged, they can't respond properly to the signal. The result? You're forced to wake up multiple times throughout the night to urinate, turning your peaceful sleep into a marathon of bathroom trips. If you're consistently getting up 2 or more times per night to use the bathroom, and this is a new pattern for you, your kidneys might be sending you an SOS signal that they're struggling to do their job properly. Warning sign number 4, the fingernail detective work. Believe it or not, your fingernails can reveal secrets about your kidney health. Take a look at your thumbnails right now. You should see a pale crescent-shaped area at the base called the lunula. It's completely normal and represents new nail growth. But there's an abnormal nail pattern that kidney specialists recognize immediately. It's called half and half nails, and it looks dramatically different from healthy nails. Instead of a small, pale crescent at the base, the entire lower half of the nail appears white or pale, while the upper half takes on a reddish-brown or pink color. We don't fully understand why kidney disease causes this specific nail pattern, but the connection is strong enough that experienced doctors consider it a significant diagnostic clue. Not everyone with kidney disease develops these nails, but when we see them, we always investigate kidney function. The phosphate problem. Now let's talk about a mineral that most people have never heard of, but one that can create serious problems when your kidneys start failing. Phosphate is everywhere in our food supply. In fact, most Americans consume far too much of it daily. Healthy kidneys handle this excess phosphate effortlessly, filtering it out and eliminating it in your urine. But damaged kidneys can't keep up, and phosphate levels start climbing in your bloodstream. This might not sound dangerous, but phosphate has a sinister characteristic. It binds with calcium to form hard, crystal-like deposits. When these calcium phosphate crystals settle in your skin, they create a condition called calcinosis cutis. You'll see hard, yellowish-white bumps under your skin that feel like small stones. Sometimes these bumps break open, releasing a thick, paste-like substance that looks remarkably similar to toothpaste. While skin deposits are uncomfortable and unsightly, there's a far more dangerous possibility. When these same crystals form inside your blood vessels, they can cause a life-threatening condition called calciphylaxis. Blood vessels become blocked, tissues don't receive enough oxygen, and the results can be fatal. But there's another subtle way high phosphate damages your cardiovascular system. Normally, your arteries have smooth, flexible walls lined with muscle cells that can contract and relax to control blood flow and pressure. When these muscle cells are bathed in excess phosphate, something extraordinary happens. They undergo what scientists call a phenotypic switch. Essentially, they forget their muscle cells and start behaving like bone cells, depositing calcium phosphate directly into the artery walls. The result is arteries that become rigid and hard as bone. You can actually feel these calcified arteries under the skin. They feel like guitar strings running beneath the surface. Warning sign number 5, the midnight cramp attack. Your body fights back against rising phosphate levels by releasing a hormone called FGF-23. This hormone forces your kidneys to dump phosphate into your urine and tells your intestines to absorb less phosphate and calcium from food. FGF-23 accomplishes this by blocking the activation of vitamin D, which is essential for calcium absorption. Over time, your calcium levels begin to drop, and that's when the midnight torture begins. Low calcium triggers excruciating muscle cramps, usually striking when you are trying to fall asleep. These aren't ordinary exercise cramps. They're intense, sustained contractions that can jolt you awake and leave you writhing in pain. But calcium isn't the only culprit. Early kidney disease can also cause magnesium deficiency and blood acidity problems, both of which contribute to muscle cramping. If you're experiencing unexplained muscle cramps and haven't recently changed your exercise routine, it's worth having your kidney function and electrolyte levels evaluated. Warning, sign number 6, the shrinking skeleton. When your calcium levels drop, your body activates an emergency response system. Your parathyroid glands release parathyroid hormone, which sends a direct command to your bones. Release calcium into the bloodstream immediately. This works beautifully as a short-term solution, but creates a devastating long-term problem. Your bones gradually weaken as calcium is continuously extracted to maintain blood levels. The medical term for this is osteoporosis, and it dramatically increases your risk of fractures. One of the most telling signs of bone loss is height reduction. If you've noticed you're an inch or two shorter than you used to be, this could indicate vertebral compression fractures caused by weakened bones. Fractures from minimal trauma are another red flag. Breaking a bone from a simple fall from standing height, especially fractures of the wrist, spine, or hip, should always prompt investigation of bone health and kidney function. The uremic toxin storm. Beyond electrolyte imbalances, failing kidneys allow a cocktail of toxins to accumulate in your bloodstream. This condition is called uremia, which literally means urine in the blood. These toxins create a cascade of symptoms that can dramatically impact your quality of life. One of the earliest and most torturous symptoms is relentless, whole-body itching that intensifies at night. This isn't ordinary dry skin itching. It's a deep, maddening sensation that can drive people to scratch their skin raw. The itching happens for several reasons. Uremic toxins accumulate in your skin tissues, causing direct irritation. These same toxins activate specialized itch receptors called PAR2 receptors, making your nerve endings hypersensitive to even the slightest stimulation. In advanced cases, these toxins actually cross into your brain and chronically activate your itch circuits, creating a sensation of itching that never stops, even when there's nothing wrong with your skin. Another sleep-disrupting symptom is restless leg syndrome, an overwhelming urge to move your legs that becomes unbearable when you're trying to rest. The leading theory connects this to iron deficiency in the brain, which impairs dopamine production. Here's how kidney disease creates this iron shortage. Uremic toxins trigger chronic inflammation, which stimulates production of a hormone called hepcidin. Hepcidin's job is to protect your body during infections by hiding iron away from bacteria, which need iron to survive. But in kidney disease, Hepcidin levels rise inappropriately, even without an infection present. Your body chronically hoards iron, keeping it away from your brain where it's needed to produce dopamine. Without adequate dopamine, you develop that irresistible urge to move your legs. Warning sign number 7, when food becomes the enemy. As uremic toxins accumulate, they begin to affect your taste and appetite in disturbing ways. Many people with kidney disease develop a persistent metallic taste in their mouth, as if they're constantly sucking on pennies. This happens because urea, one of the primary waste products filtered by kidneys, builds up in your blood and eventually appears in your saliva. Your mouth's natural bacteria break down this urea into ammonia and other compounds that stimulate specific taste receptors, creating that characteristic metallic flavor. These same compounds can make your breath smell like urine, a condition doctors call uremic fever. When your food tastes like metal and your breath smells like a bathroom, it's no wonder that appetite disappears. But the appetite loss goes deeper than just taste problems. Uremic toxins directly affect your brain by activating a region called the chemoreceptor trigger zone. This area has no blood-brain barrier, so it can quickly detect toxins in your bloodstream. When it senses uremic toxins, it interprets them as potential poisons and triggers a protective response. It tells your body to stop eating and vomit to prevent further poisoning. While this is an excellent defense mechanism against actual food poisoning, it becomes a serious problem when those toxins are actually just waste products your kidneys can't eliminate. The result is chronic nausea, vomiting, loss of appetite, and progressive unintentional weight loss. Warning sign number 8, when your blood won't clot. Here's something that might surprise you. People with kidney disease bruise incredibly easily, often developing massive bruises without even remembering how they got injured. Normally, when you cut yourself or bump into something, tiny blood cells called platelets rush to the damaged area and stick together like microscopic band-aids, forming a plug that stops bleeding. But uremic toxins interfere with platelet function, making them less sticky and less effective at forming clots. This leads to several noticeable symptoms. Your gums might bleed more easily when brushing your teeth. You might experience more frequent nosebleeds. Most obviously, you'll notice more bruises appearing on your skin, often without any memory of the injury that caused them. This bleeding tendency isn't just cosmetic, it can become dangerous during injuries or medical procedures. Warning sign number 9, the crystal coating. In advanced kidney failure, there's a rare but dramatic finding called uremic frost. When kidney function becomes severely impaired, your sweat actually becomes concentrated with urea and other waste products. When this toxic sweat dries on your skin, it leaves behind a fine white crystalline powder that looks like frost coating your body. This is literally your body's waste products crystallizing on your skin surface. Uremic frost is thankfully rare and only appears in very advanced kidney failure. But when present, it indicates the need for immediate dialysis or kidney transplantation. Warning sign number 10, the heart's cry for help. Uremic toxins can cause inflammation of the pericardium, the thin membrane that surrounds your heart. When this membrane becomes inflamed, a condition called pericarditis, it creates a unique and dangerous situation. Unlike other inflamed tissues that can rest and heal, your heart can't stop beating. With every heartbeat, the inflamed pericardium rubs against itself, causing significant chest pain and creating a distinctive sound that doctors can hear through a stethoscope. This sound, called a pericardial friction rub, resembles leather rubbing against leather or sandpaper scraping together. It's the actual sound of inflamed tissue moving with each heartbeat, and it's a sign that kidney disease has progressed to a dangerous level. Warning sign number 11, the energy thief. Fatigue is perhaps the most common complaint among people with kidney disease, And it has multiple causes that we've already discussed. Poor sleep from itching and restless legs, electrolyte imbalances, and uremic toxin buildup. But there's another major contributor that's actually treatable. Your kidneys produce a hormone called erythropoietin, or EPO, which signals your bone marrow to manufacture red blood cells. You might recognize EPO as the performance-enhancing drug that some athletes have used illegally to boost their red blood cell counts. When your kidneys are damaged, EPO production drops dramatically. With less EPO, your bone marrow produces fewer red blood cells, leading to anemia. Fewer red blood cells means less oxygen delivery to your tissues, which translates to crushing fatigue. Simple activities like climbing stairs can feel impossible when your blood can't carry adequate oxygen. Fortunately, we now have synthetic EPO injections that can effectively treat this anemia and restore much of the energy that kidney disease steals. The silent danger. Perhaps the most dangerous warning sign is no warning sign at all. Kidney disease is classified into 5 stages, from mild stage 1 to severe stage 5, where dialysis becomes necessary. The frightening reality is that most people don't experience noticeable symptoms until they have already reached stage 3, meaning they've lost more than half of their kidney function. If kidney disease is discovered earlier than this, it's usually found accidentally during routine blood work or urine testing. This is why prevention and regular screening are absolutely critical for kidney health. The root causes. Understanding what damages kidneys in the first place is crucial for prevention. While there are many potential causes, 2 conditions account for the vast majority of kidney disease cases: diabetes and high blood pressure. Both of these conditions damage the delicate filtering structures we discussed earlier. High blood sugar acts like tiny glass shards flowing through your kidney's filters, while high blood pressure creates excessive force that gradually tears these microscopic barriers. The encouraging news is that both diabetes and high blood pressure are largely preventable, and when they do occur, we have excellent treatments available. Another increasingly common cause is the overuse of pain medications like ibuprofen and naproxen. These over-the-counter drugs are so readily available that people often underestimate their potential for harm. Chronic use of these medications can damage not just your kidneys, but also your stomach and heart. If you're using these medications regularly, it's important to discuss kidney function monitoring with your healthcare provider. Your action plan. Your kidneys are remarkable organs that deserve your attention and protection. If you've recognized any of these warning signs in yourself, don't panic, but don't ignore them either. Schedule an appointment with your healthcare provider to discuss kidney function testing. Remember, early detection and intervention can often prevent further damage and even reverse some existing problems. Your kidneys have incredible healing capacity when given the right support. Your kidneys are amazing organs that work incredibly hard for you every single day. If you recognize any of these warning signs, don't ignore them. See your doctor and get checked. If this video helped you, please share it with someone who needs to see it. You might just save their life. Thanks for watching Well Docs. Hit subscribe for more health content that actually matters, and I'll see you in the next video.